Hi, everybody. I'm Denise from Switzerland.
Hi, Denise. Do we say guten Abend or bonsoir?
Well, either of them, yes.
Good stuff. Hi, Denise. Welcome.
Thank you.
So welcome to the event, everybody. Today's event's pretty informal. I don't know how many of you have already been on some of our virtual tours. Those ones we kind of have presentations and share screens for most of the time. If you haven't been on all of our virtual tours, they're excellent, and I encourage you to check them all out. We now have, I think, 9 different routes, which you can see on the website. Most of them we offer a couple of times a week. But today's event is going to be a bit more informal, maybe an hour or so, depending on how many questions we have. And it just gives you a bit of an opportunity to hear from 2 main speakers. We're joined today by Mohammed Barakat, who many of you will know. He's our senior Palestinian partner at Green Olive, and he'll be able to give a bit of a sense of what's been happening recently on the ground in the West Bank and Palestine and East Jerusalem, where he lives. Because I know that a lot of the topics which we cover in our kind of regular weekly online tours maybe don't touch on some of the important current events which are happening day to day. And I'm sure that many of you have questions about what's been going on here. I know a lot of you try to come visit us pretty regularly, so I'm sure there'll be some interesting things that have changed in the last few months. And the other speaker we are hopefully going to be joined by today is Steve Sosby, who is the head of the Palestine Children's Relief Fund. This is a great charity which we're very proud to have been working with for the past couple of months. We've worked with 2 different charities so far for our online tours. As I'm sure most of you know, at the end of our online tours, we ask for contributions, whatever you felt the tour was worth. And as well as supporting Green Olive, we also donate some of those contributions to these 2 charities. And like I said, for the past few months, we've been donating to the PCRF, which is a really, really great charity, which does a lot of amazing work supporting the health specifically of Palestinian kids. A lot of the work they do is in Gaza. So hopefully Steve will be with us to talk a bit about the work that they do. I don't know if Steve's here already under a different name or anything. If you're here, Steve, you can say hi. Steve was going to speak first, but as he isn't here and Mohammed is, why don't we switch the order around a little bit? And we can talk to Mohammed first. So, Mohammed, I guess maybe I'll start things off by asking you a couple of questions, and then we can throw things open to everybody else. But Mohammed, if I could ask you first of all about how things have been in your neighborhood and the circles that you are in, the people that you talk to regarding the coronavirus, because we know that Israel is leading the world in many statistics for vaccinations. I don't know how people all around the world are being vaccinated in your various countries, but in Israel, most adults have now been vaccinated. And East Jerusalem is this kind of in-between situation where most people living there are not citizens of Israel, but they are eligible for Israeli healthcare as permanent residents of Jerusalem is the official title. But I wonder how many people you know have been vaccinated, what the general kind of access is to these vaccines, and if you have any other points maybe you'd like to make about the coronavirus.
Good evening, everybody. It's our time. So hi for everyone. We had been in this situation since the last year. And we are almost about a year that we stopped working. And it started in Bethlehem, in fact, in the West Bank. And that time, the Palestinian Authority have completely closed Bethlehem area for a couple of weeks till things came down. People at that time were not even believes in these things, you know, they were suspicious about it. But in fact, the last months, people started to feel that this is a serious pandemic, and it's really a dangerous one, because several of those main figures in the Arab world and also in Palestine have passed away because of this disease, because of the corona. So people started to believe this is serious thing. So we didn't believe in vaccination, but nowadays I myself had just got the first, drop of it, the vaccine.
Good stuff. Well done.
Even my family now, most of them started to. Still, part of the people doesn't believe in it. In fact, we as Palestinians living in the West Bank, living in Jerusalem exactly, in specific, we are covered with the Israeli healthcare. And that's why Israel wants us to get this vaccination. And in fact, Israel have announced that people who are not having this vaccination, they are not allowed to be in, malls, commercial centers, other kinds of things. So you have to prove that you got already the vaccination. So that's why people started to go to have the vaccination. I believe that nowadays in East Jerusalem, over 60 to 70% of the population of East Jerusalem have already got the vaccination. Now, in the West Bank, which is mainly serious nowadays, a lot of cases already have been found and declared in the West Bank. Mostly even death cases have been discovered by and declared by the coronavirus. But in the West Bank, they have no any kinds of importing the vaccination direct to the authority. It has to go through Israel. We don't have any kinds of opening border between us and the world. Everything comes through Israel, either by port or airport or the access to Israel or to the West Bank. So up till today, the Palestinian Authority have asked the Israeli occupation power to provide them with the vaccinations, but not yet Israel have responded. They only got 20,000 of these vaccinations for, it's only for 20,000 people, where some of it had been given to the, what we call it, the high community in our society in Palestine. Mainly, some of them are ministers or some of them are officials. And that's where they, have caused a trouble with the Palestinians people. Several of those human rights centers have already declared yesterday and today that the Palestinian Authority have the responsibility to give the vaccinations first of all to its people, and mainly the youth. The older people, and also the people who are in danger of having this disease, and so on. And then for the youth and the young people. So now we are in trouble in the West Bank, especially that we don't have enough vaccinations for all the people. You have to understand we are almost 3 million living in the West Bank, and we need it urgently. And the Palestinians have no even budgets to buy this vaccination. So now they started to ask the internationals to help them in providing us with this vaccination. So I think that the Chinese are going to send some of their vaccinations to the Palestinian Authority, even the Russians. So now, but Israel is not accepting now these vaccinations. I don't know if they will reach an agreement with the Palestinian Authority to receive it and to ship it or to hand it to the Palestinians. So this is what is happening in the West Bank, according to the corona disease virus. But in fact, we have several areas in the West Bank now is closed areas. We started to have closure from 7 o'clock in the evening up till 6 o'clock in the morning in all over the West Bank, cities and villages and so on. Sometimes they are closing even the traffic between the cities, which I think that the Palestinians are going to do that within the coming weeks if they didn't receive the vaccination. So it will be important for them to close the cities and to stop all the traffic between the cities as a way to control the area. That's what is happening. If there is any question, I'll be ready to answer about this thing.
I have one more before I open it up to everybody else. Sorry to steal the limelight.
Okay.
We saw in the news the other day that a Palestinian politician, Mohammed Dalan, who is kind of affiliated with Fatah, the ruling party, but he seems to have kind of gone behind Mahmoud Abbas, the leader of Fatah, to source vaccines kind of himself. He's very close with the UAE, and he managed to get, I think it was 20,000 vaccines taken to Gaza through Egypt. And I wonder if you predict that this is the beginning of kind of staking a claim which is kind of different within the party, and maybe he's going to try and make a move towards potentially becoming, I don't know, the new president. We have elections scheduled for later this year, and I wonder if you have any predictions on these kind of factions that we see in the Palestinian Authority and even within Fatah.
Well, what I know about these things, that there is a kind of reconciliation in Fatah movement between Mohammed Dahlan and the Palestinian Authority. There are involvement between several of those politicians or kinds of organizations that they are bringing back Dahlan in a way to the Fatah movement. So to prove that he is having a goodwill to the Palestinians, so he have transferred, as what we have said, 30 vaccinations to Gaza, because he's from Gaza. And I think that all these, what's happening, it's just coming towards what we are having the next months. We're going to have elections. So this is connected, that he wants to be part of the Fatah leadership movement, as to have, if Fatah will go for one list, so he wants to be his party, to be part of Fatah movement list. But I think that there is a big, rejecting in Fatah movement against this guy, especially in the West Bank. They believe that he's a traitor, and he should not be part of the Palestinians liberation movement completely. So there is a big crack in Fatah movement itself. Some are willing to have the reconciliation between him and the Fatah leadership, and to come back to obtain him and to have him back in Fatah. But the majority in Fatah, they don't want him back in the movement. So this is what is happening. So they are taking the pandemic as part of, we call it covering their work in a way that they are willing to help the Palestinian people in bringing the vaccination, buying it, and trying to help in this very hard circumstances for the Palestinians. But I think we will have a special part of our night to talking about the elections and what will happen. So I'll be to explain to you the elections and what is going on for the elections. So this is one of what is going to the elections.
Sure. Okay, so maybe we'll leave the elections for now, but I see Chris has already typed a question. Do you want to ask your question aloud, Chris? Do you want to unmute yourself, or I can read it? Sure. So Chris asks, hi Chris.
Is the refusal of the vaccine to the Palestinians, is it a punishment, or do they do this with other things? Is it always like this between the Israelis and the Palestinians?
Well, in fact, Israel have, since Oslo, we were talking about the power of the PLO, which was out, in Tunisia, in Lebanon before, in Jordan. So they were having the power by themselves. Now, what happened for Oslo? They brought the Palestinians Liberation Organization from outside, inside Israel, and they locked them in. So as what we are saying, just showing that they brought the lion from the forest, bring him inside the cage, and they are the responsible of feeding him in every kinds of, needing things, water, electricity, food, everything comes through Israel. So we are completely in a big jail in Gaza 1 and also in the West Bank. But what Israel is doing, in fact, again, Israel is using these things, the budgets for the Palestinian Authority, which was coming from the international donations, the Americans, the Europeans, others, even from the Arab countries. They are the ones who let those people to donate and giving it to the Palestinian Authority, or to stop it as a way to put more pressure. Another kinds of pressure that they are using it, but the Israeli government, according to Oslo Agreement, they are collecting the additional tax because we are buying all our stuff from Israel. We are buying from Israel over $4 billion a year for the needs of the people under the occupation inside the Palestinian Authority area. Now, Israel is collecting the money from the resources which we are buying from and bring it back to the Palestinian Authority, which comes usually more than hundreds millions of shekels a year, more than $200-300 million every year. So they are using it as a way to put pressure over the Palestinian Authority, because sometimes they will not paying it to the Palestinian Authority, stopping it because they need kinds of approval by the Palestinians towards the Israeli government. So they are using it. Even the vaccination also, it's part of their pressure against the Palestinian Authority. Now, if we look at Gaza, which Hamas is the power over there, Israel is giving the power to Qatar to fund Hamas through Israel, millions of dollars each month, as a way to leave Hamas in its power, to give the power to Hamas to continue ruling Gaza. So Israel is playing in this kinds of policy to keep the division between the Palestinians in Gaza and in the West Bank, and both of sides are in need that the Israeli government is the one responsible for their budgets. It never comes through any kinds of internationalists towards the Palestinians unless the Israeli government will approve it. This is what is happening. So they are usually using these kinds of things to put pressure over the Palestinians.
Thanks, Mohammed, and thanks for the question, Chris. So I see no more specific questions right now, and we are now joined by Steve Sosby from PCRF. So maybe we'll come back to you, Mohammed, if that's okay, and I'll just let Steve introduce himself, and you can, of course, people in the audience, think of more questions for both Steve and Mohammed if you have them. But hi, Steve, it's great to see you, and welcome to Green Olive.
Thank you for having me. Sorry for being a little bit late. I got caught up in another call.
No problem.
And thank you for all of the great work Green Olive and you're doing and your volunteers are doing. It's really a great sign of hope for Palestine and for the cause that we all support dearly in our hearts. Thank you, Mohammed, for your very interesting presentation as well. For those of you who don't know, I started an organization 30 years ago called the Palestine Children's Relief Fund. And that was while I was working in Palestine as a journalist. And, you know, not as a journalist in the sense that it was a job for me. It was a way for me to want to share the stories of the Palestinian people, the Palestinian struggle with common Americans. For the most part, I'm sure most of you realize Americans are not very knowledgeable when it comes to world events, and particularly when it comes to the issue of the Middle East and of the Palestinian struggle for freedom, for justice, for equality. They are particularly ignorant, not just because Americans are an inward-looking people, but also because the source of information that we get in this country is relatively tainted towards the Israeli narrative, the Israeli perspective, and we don't usually get to see or understand the truth of what really life is like in Palestine for Palestinians living under occupation, or for the lives Palestinians have to endure as refugees outside of their country, unable to return and prevented from returning, actually. So I started working as a journalist, as an activist journalist, to share these stories, much the same way Green Olive is doing. You guys are doing here. And at that time, we didn't have the same tools and platforms that we have available today with social media and so on. So it was a little bit more of a struggle, but the same mission exists today that existed before, is that, and I believe this, and I'm sure all of you who've been to Palestine and go back to your home countries, if that's something that you do, we all understand clearly that the disconnect between what really is happening in Palestine, the reality of life that the Palestinians have to endure every single day under occupation, and what is presented outside are two completely different things. So I think one of the most important things we can do, and I commend you guys for doing this here today, is to continue to try to, first of all, present the truth as we know it and as it exists on the ground in Palestine, the subjugation of the Palestinian people, the dehumanization that goes on daily in the Western media towards the Palestinians, and the struggle that they have to just keep in their homeland, stay connected to their land, at the same time, every effort being made to uproot them and deny them their freedom. So while I was working as a journalist in Palestine, I met some kids, a brother and sister from the West Bank, who had been injured by an Israeli bomb, an Israeli explosive. The boy had lost his legs and lost a hand. His sister was badly injured as well, suffered compound fractures of her legs. And I wanted to help them. I mean, I was always somebody who believed it wasn't enough to just write words. It was also important and crucial to act on those words. And so I decided to try to arrange treatment for these kids in the United States. And I was very young at the time, and was managed to find a lot of hospitals that would start taking Palestinian kids for free. And I felt that was an important way to help these children, first and foremost, get medical care they could not get in the West Bank and Gaza. Secondly, it was a great way that we could get that treatment for free. The American health system is a free enterprise system. So unlike European countries and the European model, which is more beneficial for the European citizens, in the United States, the CEO of any hospital can accept a child for free and not have to go through a government bureaucracy that you might have in a European country that has a socialized system. So free medical care for these children was possible. And thirdly, it exposed them firsthand to American citizens and to the American people who need to understand how our tax money was being spent on the ground in Palestine in a negative way against our basic core values of freedom and justice. And fourth, it was a great way to organize and mobilize the Palestinian community in the diaspora to be more connected and more involved to the Palestinian struggle, especially during the first Intifada, which was a great source of pride for the Arabs all over the world who looked towards the Palestinians in the West Bank and Gaza unified for one of the first times, really, not separated by religion, not separated by class, not separated by anything other than they were unified completely behind the struggle of ending the occupation and freeing themselves. So that was why I started the organization, and that's why I started arranging care for children. And over the years, that organization has grown. We've taken on bigger projects. We now send volunteer missions by the hundreds every year. Hundreds of doctors come in from all over the world as volunteers to give their time and their skill to operate on Palestinian children in hospitals within the government sector in the West Bank and Gaza, in Lebanon's camps in Jordan. And these doctors provide crucial services which are not available in the Palestinian healthcare, open heart surgery, very specialized procedures, and at the same time, most importantly, provide training and experience for our young local doctors in Palestine to gain the knowledge to be able to do this work themselves. We also provide a variety of different types of humanitarian relief and humanitarian support on the ground in Palestine and in the camps in Lebanon and Jordan, which is to address whatever areas of need that there are. And these needs obviously change based on the political circumstances at the time, whether the Israelis are bombing the Gaza Strip, whether there's a COVID outbreak, obviously, that we've had over the past year, whether there's a significant political crisis in a place like Lebanon, which impacts the Palestinian refugee camps more than any other segment of society there. We are able to respond with urgent humanitarian relief based on what those needs might be. And those needs are continuous as well. So obviously people in southern Gaza and Rafah and Han Yunis have different needs than people in Jenin. Their situation is different. They have access to less support, as Mohammed mentioned. Some of the challenges that they face in Gaza, we don't have in the West Bank. And then, of course, we have ongoing programs. So we have sponsorship programs for sick kids and so on. But the most important aspect of our work is really the long-term development of helping to build a sustainable, independent Palestinian health sector. You heard Mohammed mention the billions of dollars that the Palestinians are obliged to pay to their occupier, to the Israelis every year for basic access to materials and services that they otherwise should freely have access to as an independent country, which they're not, of course. Well, one of those areas is very significantly is in the health sector. And because of the lack of development in the Palestinian health sector, a lot of services the Palestinians have been dependent on Israeli hospitals and the Israeli health sector to provide services for their own patients. Not for free, of course. They cost millions and millions of dollars every month, have been leaving the Palestinian health sector, have been leaving the Palestinian economy to go into the Israeli economy to provide medical care, medical treatment for Palestinian patients. So our goal is to develop Palestinian health services in the public sector, because that's where that's where poor children go and poor patients go to get access to care. Develop the public health sector in the West Bank and Gaza so the Palestinians can provide a better quality, a better standard of care that is currently not available. And some of the areas that we've done that in particular is in, for example, our 2 pediatric cancer departments. The first one we built is in Beit Jala Hospital, which is in Bethlehem. And that was named after my first wife, Huda al-Masri, who I was married for 17 years to an amazing Palestinian woman who passed away from cancer in 2009. She was from Ramallah. And we built the organization together for 17 years. So it was, I wanted to honor her in 2 ways. First, by putting her name on something that kind of represented her courage and dignity and legacy as a proud Palestinian Arab woman. And secondly, to fill a gap in the health sector. If she, at that time, when we opened that department in 2013, there was no pediatric cancer care for children in the West Bank in the public sector. Those children had to ask for permission from the Israeli occupying military to go outside of their country to get treatment that should be available to them locally. So we did a crowdfunding, we held fundraisers, we did whatever we could to raise the nearly $2 million it took for us to build a brand new department in Beit Jala Hospital, which opened in April in 2013. And since then, hundreds of children with cancer in the West Bank and kids from Gaza have gone there and gotten the free care that they otherwise couldn't get. What that does, obviously, is save the millions of dollars, because before, those kids would go to Israeli hospitals for simple things, medication, chemotherapy, things which it's not simple, but in the overall context of how children get treatment in the public health sector, it is simple. Those are now provided for them for free, near their families, within their own country, and being cared for by Palestinian doctors and nurses. So we're very proud of that accomplishment. And 2 years ago, exactly 2 weeks ago, 2 years ago, we opened, that was our anniversary, we opened a brand new pediatric cancer department in Gaza, 4 times bigger than the one that we did in Bethlehem. And the reason we built 2 of them is because children in Gaza cannot get out in many cases for medical care which is available to them, even in our department in the West Bank. A lot of times those kids are denied permits, or their permits are delayed, or they're not able to travel, most commonly not able to travel with their mothers. And we have children at the age of 2 years old, 1 year old, 3 years old with leukemia in Gaza, who we would have to send to our department in Beit Jala for a month, 2 months of treatment with somebody who was 55 years or older, because that was the requirement. That is the requirement of the Israelis to give a permit for somebody only over the age of 55. So they would have to go with a grandparent, a great grandparent, a great aunt, a relative, a neighbor. So you can imagine the psychological impact on a young child being away from his mother and from his family. Whereas building that new department in Gaza, it's been a great benefit to the health sector there. More importantly, these kids are getting treatment near their families, expert care, in one of the most modern, beautiful facilities available. So those are some of and we currently have 2 big projects in the West Bank. We're building a brand new pediatric intensive care unit and a pediatric cardiology department in Ramallah, the center of the West Bank. And the purpose of those 2 departments, again, fill gaps in the health sector so we don't have to depend on anyone, whether it's the Israelis, the Jordanians, the private sector, to provide care and services for our children. That's how we believe we can contribute to this cause in a way which isn't blocked, because so many avenues in showing our solidarity and our support and our love for the Palestinian people, those are blocked ways. We know that this is ultimately a political struggle, the Palestinians, and a national struggle. The Palestinians are struggling for their freedom, for their nation, for their country, for their rights. And the way that we can contribute to that struggle is by helping them to achieve a better standard of care for their patients, provide a better standard of living within the occupied territories, help show solidarity and support for the people there by healing their children and developing services that are otherwise not available. And that's how we've been doing it for 30 years now. And I'm very honored and privileged to be able to serve the Palestinian cause in a positive way that does have an impact in developing an independent health system, and more importantly, showing our brothers and sisters in Palestine and our Palestinian brothers and sisters living in the diaspora our support, our love, and our solidarity with them. So that's who I am. That's the work that we do. I really appreciate Alex and you guys giving me this opportunity to present our work to you. And I'm happy to answer any questions. And I think we have, Alex, if you have a video you wanted to show about, I think our cancer department, maybe be a great time to do that now.
The Dr. Musa and Suhaila Nasser Pediatric Cancer Department. In February 2019, PCRF opened the first and only pediatric cancer department in the Gaza Strip, named after Dr. Musa and Suhaila Nasser, who helped to start PCRF in 1992. Before we opened this department, all children with cancer in Gaza had to leave their families and travel outside for difficult care that was often not completed due to the lack of permits and closures of borders. Thanks to hundreds of donors all over the world, this department was built with the best equipment and materials to ensure that children fighting cancer in Gaza get access to the best care possible. In addition to building this multi-million-dollar department through private donations, PCRF continues to keep a staff of social workers and project managers inside the department to provide children child life services, which includes tutoring and other activities to help support them during their long and often difficult treatment. We also continue to support the training of staff, provide chemotherapy drugs that are in short supply, and assist with the ongoing care of hundreds of children with cancer in Gaza each year. Thanks to our supporters, volunteers, and donors, PCRF will continue to support the needs of our sick children who are battling cancer in Gaza and ensure that they receive the best possible care they need and deserve. To support this department and our ongoing needs, please visit www.pcrf.net.
So that gives you a little bit of an idea of that particular project. I've seen a couple questions concerning mental health and so on, which I can address, Alex, unless you wanted to do that.
I'd just say one thing before I go to questions, which is to thank you, Steve, very much for joining us. I know that you're a very busy man. I mean, the work you're doing is amazing, and I'm sure the amounts of money that we're talking about donating are just a drop in the water of what you need and what you probably get from bigger donors. So we really, really appreciate you spending time with us today. So yeah, just from the behalf of Green Olive, we're of course very happy to be working with you and want to thank you very much for the great work you're doing. But yeah, let's open up to questions if you want to answer any of those, or if we can have someone ask the questions. How do you prefer to do it?
I see them over here in the text chat area, so I can answer a couple of them quickly, and I don't know if maybe Mohammed, he wants to answer as well. First of all, thank you, Alex. Thank you all again for giving me a chance to speak. I think we all have to give whatever we do for Palestine in any context, Alex, and I think this is true for your group and for our group. Whatever it is, it's not enough. They deserve all of our support, all of our solidarity, and all of our compassion and love. So it's truly an honor to do whatever we can for the Palestinian people, considering what they've had to go through for over 100 years now. The issue of mental health, so we have a mental health program in Gaza. We've had it since the war of 2014. I hate to call it a war. It was more like the bombing of Gaza in 2014 during Ramadan. Gaza, the children in Gaza have a huge level of post-traumatic stress disorder, and generally, as you all know, this is it was called shell shock during the first war, I think, and this is something that usually soldiers who are involved in combat experience. I know Vietnam veterans would come back and have that 1,000-yard stare and have the experience of seeing firsthand trauma, but these aren't soldiers. These are children in Gaza who, by the hundreds of thousands, show different signs of suffering from post-traumatic stress disorder, which is unconscionable to think in this world today that children, innocent children in the Gaza Strip or anywhere in the world are subjected to these kinds of traumatized life experiences. So what we've been doing, it's a huge, huge challenge to deal with mental health issues because the source of that trauma continues. The bombings in Gaza haven't stopped. The trauma of living under siege and under occupation in Gaza continues. And that's the source of the post-traumatic stress and the anxiety and the mental health challenges that children in Gaza have to endure. What we're doing is we're providing because the resources are huge, we're talking hundreds and thousands of children who have some levels of anxiety and post-traumatic stress as a result of living in Gaza. You can't treat all of those children with the limited resources of an organization like ours. We're focusing on areas where we can impact within our existing program. So for example, we have mental health professionals in our cancer department who come and work with the staff, work with the families, and work with the patients to help provide them mental health therapy and treatment, counseling. We also have a program for amputees in Gaza. And you saw one video. We have literally dozens of different programs like that one you saw. And one of them is for the children in Gaza who are amputees. And some of them are gunshot injuries, as you know, from the Great Return March that was going on for right before COVID for a couple years during 2018, 2019. Palestinians would go to the wall that surrounds Gaza and demonstrate for their right to return to their land inside 1948 Mandate Palestine. And, and hundreds of them were being shot, many of them killed, and many more were being maimed. And we have a lot of kids there who are amputees as a result of the use of high velocity gunfire. We also have kids who are born with congenital birth defects or car accidents or cancer. There's lots of reasons children become amputees in Gaza. We put together a program where we have identified all of them and we're providing them medical care and medical support in the Gaza Strip. And part of that is also mental health training for those kids. As you can imagine, when you lose a limb, there is a psychological and component that's involved with that as well. So we do have a mental health program, and a lot of other organizations in Gaza do as well. UNICEF, there is the Gaza Community Mental Health Program, which is excellent in the Gaza Strip as well. Many of you might have heard of them. But mental health is one of the most important areas because of the impact that the occupation and the impact of the use of modern military weapons on a civilian population has produced among these innocent children. And we all know Gaza is mostly young people. It's a population that is skewed towards kids and towards youth. So those who are being impacted most by the use of bombs and gunfire and artillery fire on the Gaza Strip are children. There was another question asking about pediatric cancer in Gaza because of environmental issues. There's been a lot of debate about whether the Israelis are using uranium weapons in the Gaza Strip, but there is no conclusive evidence that that these type of weapons, which would be the main source of producing cancer there. I have since remarried to a doctor who is a pediatric oncologist, and she actually volunteers in Gaza. And there is no evidence that there is environmental factors in Gaza that produces pediatric cancer. For adult cancer, probably so. There's different kinds of acquired cancer from environmental factors here. But that would be a great study by an NGO or by a medical facility to go and do something related to that. We do not have registered UK charity status yet, but we are in the process of registering in the UK. So hopefully within the next few months, I have a call about that tomorrow with some UK persons that are going to help us register. So that's those questions. I know, Mohammed, you might want to ask, you might want to answer the question of the water situation in Gaza. You might be more able to give a better answer than myself on that.
Well, I think that Gaza is one of those areas in Palestine, which is really very, what we call it, getting less water system, because most of the aquifer, which comes to be in Gaza, it is connected with the Israeli, what we call it, dirty water that Israel is just dropping it towards, because Gaza, it's on the shore area, which is the sea side, which is zero, and most of the water, the dirty water, which Israel is just pumping it down, it goes down to the aquifer, which is in Gaza, and this is very polluted water that the Palestinians in Gaza, and according to the international experts, water experts, they said Gaza, the water in Gaza is not suitable for drinking mostly. They gave it as 2020 was the year that Gaza will be out of clean water. So again, as I told you, that even everywhere in Palestine, in the West Bank and Gaza, we are still buying our water from the Israeli water company. And usually the Israeli water company, mainly in summertime, they are not providing us with the right amount of water for all over the West Bank mainly and in Gaza. Even the electricity, the same. Gaza mostly having about 8 to 10 hours a day, 24 hours, providing them with electricity. Just imagine summertime, very hot, and they needed coolers and so on. They didn't have it in wintertime for stoves and so on. They don't have it. So it's a terrible situation in both sides, in Gaza and in the West Bank. Water issue is a very important, where you could see it clearly that most of our water resources is being done by the, taking the water out from our main water resources through the Israeli water company, providing the settlements around the Palestinian towns, around the Palestinian cities, taking the priority for the Israeli settlers, providing them with over needed. In some areas in summertime, some of these settlements are using each settler over 300 to 350 liters per day, where Palestinians have no chance to get about 40 to 60 liters per day. Because the water usually runs in the cities, in the West Bank and in the villages twice a week, maybe once a week. So you'll be privileged if you will get it a couple of days in a week, and you have to store it. So on over the roofs of the buildings in the West Bank, and even in Gaza, you will see the water tanks to fill these tanks when the water runs, direct from the water pipes to your home, and that's where you will just store it, because the other days will completely close. And this is a big problem that we are facing. Israel has the power to solve it, but usually this is part of their pressure against the Palestinian Authority and also against Hamas in Gaza. One thing that I want to draw your attention about the healthcare, all the refugees in the West Bank, in the refugees camps in the West Bank and Gaza, they should be getting their healthcare by the UNRWA. This is part of the budgets which comes to the UNRWA to provide services for the healthcare to the Palestinian refugees. So this is part of the work of the United Nations Relief Working Agency to the Palestinians, that they have to provide them with the vaccination against the corona. They should do that, but I think that the UNRWA have taken this thing out of their shoulder and just drop it to the Palestinian Authority. They are the responsible of the Palestinian Authority. So I think that the Palestinian Authority have to go on to show to the world that those refugees, they are part of the main case of the Israeli-Palestinian case, and they have to be provided with the healthcare. They should. The internationals, the United Nations has to provide those refugees with the vaccination, and they have to put pressure of Israel to transfer these vaccination from anywhere in the world to the Palestinian refugees in Gaza and in the West Bank. This is one of the main thing that the Palestinians completely are ignore of it, and that's one of the things that the internationals have to take a further step forward to provide the Palestinians with the vaccination.
Yeah, thanks, Mohammed. I think there's 20%, is that the number, that COVAX, which is the kind of World Health Organization's vaccination plan, but 20% is still obviously nowhere near enough.
No, it won't cover anything.
Steve, maybe I could ask you, if we talked before you spoke a little bit about the situation regarding COVID in the West Bank and East Jerusalem. Maybe you have any insights. I'm not sure about the situation in Gaza. I'm sure there's probably, I don't know, many bigger perhaps issues in terms of health there, but the numbers are also quite worrying regarding COVID in Gaza. Do you have anything? I
think that's the most worrying issue right now, for sure, is the COVID situation in Gaza when it comes to the health health status of the Palestinians. Some vaccinations have started to arrive into the Gaza Strip. We have in our cancer department one of the only 2 refrigerators in the entire Gaza Strip that is able to store the Pfizer vaccine and some of the other vaccines that are required with the type of temperatures that are needed for storage. So we have some of the vaccines stored in our department in Gaza, and some of the vaccinations have been going out to health workers in Gaza at a very slow rate. However, with a population of 2 million people, they're far away from getting anywhere near the number of vaccinations that are required to make Gaza a safe place again. The challenge in Gaza isn't necessarily the population. 2 million is not such a huge number when you compare it to some of the places like the United States and so on. However, in Gaza, we have a couple of serious factors. One is the lack of resources, intensive care beds, ventilators, and some of the more sophisticated treatment services that are necessary to combat the COVID outbreak. There's just a shortage of beds, there's a shortage of specialists, there's a shortage of equipment, there's a shortage of drugs as a result of the closure and the occupation and so many other factors that Gaza, that we've spoken about already and Mohammed articulated very well. The other reason, or the other issue is the population density. Once an outbreak happens in a place where people are living in some of the most densely packed areas in the world, these refugee camps, Jabalia, Han Yunis, Rafah, Shati camp, these are literally some of the most congested places on planet Earth. So keeping the most important challenge the Palestinians initially faced, and they did very well initially, was the prevention of the outbreak. But unfortunately, even a place like Gaza, which has been called by the United Nations the world's largest open air prison, even a place like that, it's impossible to keep out an airborne viral infection like COVID-19. So with that being said, the Palestinians unfortunately have had to endure an outbreak there. Fortunately, one of the positive things of having such a young population is that some of the this is a disease that really impacts people who are older worse than younger. So we're not seeing the same level of the same death rate that we've seen in other more countries with a larger older population, like in Europe and in the United States. However, that doesn't change the fact that it is a very dangerous and significant virus that the Palestinians deserve and need to be protected from and need to be vaccinated from. And we hope that soon the vaccinations will reach Gaza and the West Bank so that people living under occupation will have the same chance to be safe that their friends in Israel are experiencing and enjoying right now.
Right, it's a basic right. Good question came from Brooke. Brooke, would you like to ask that question? If you don't want to, that's okay. But if you want to unmute yourself, and nice to see different people's faces.
By the way, Brooke, she's a friend. She was here a couple of times. She worked with the Palestinians in the refugee camp of Balata.
It's good to see you. It's good to see you, Mohammed. How are you?
I'm fine, thanks.
Am I seeing the wall of your home? I hope. Are you at home? I recognize what's on the wall.
Sure. Yeah.
No, I had a couple of questions. Among other things, I would love to hear Mohammed talk about what the issues are with the election, because I don't know a lot about that. But I was asking, hello, good to see you.
I miss you. Well, I miss you.
Oh, fine. You look great. It's wonderful to see you.
We miss you, yes.
Yeah. No, my questions, since I'm myself a mental health professional, my questions for Steve, whose presentation I really appreciated. I thank you so much for that. Was about if there is, since I do a lot of work with the psychiatric effects of traumatic brain injury, and since there's a lot of traumatic brain injury in war-torn areas or places where there's been a lot of bombing, and I have never been able to find out if in Palestine there is any program that specifically addresses the very complex sequels of traumatic brain injury. And my other question, which is not related to that, was about UNRWA, knowing that apparently the Biden administration is supposed to be renewing the US contribution to this agency. Is that likely to make any significant difference in the availability of healthcare of healthcare in occupied Palestine, in the refugee camps, I mean.
Thank you, Brooke. Thank you for your question. I appreciate it, and for your kind words. And also, Balata camp is one of my favorite places in Palestine, despite it's a refugee camp. The people there are amazing, and that's where the Intifada began in the West Bank back in 1987, after it had started in Jabalia camp. So Balata always deserves respect for being the first place to resist officially in the first Intifada after Jabalia camp. To answer your first question about the neurological brain injury program, you know, most advanced countries and most advanced health systems do have an institute that provides rehabilitative services, studies, research, and care for patients who do endure traumatic brain injuries. Unfortunately, in Palestine, with its lack of resources and lack of specializations within the health sector, they do not have any such institutes or departments or programs set up. They do have great doctors there who work under extremely difficult circumstances and challenges without this access to resources that their colleagues have in other countries. But unfortunately, you know, just trying to provide the most basic level of health services often can be a daunting task. So that's not to say that this is not something that we're thinking about and trying to put together. We do have neurological and neurosurgical teams going regularly to Palestine, and they do provide treatment for patients who need surgery. But often, as you know, these type of brain injuries cause hemophilia, quadriplegia, a lot of different types of neurological injuries which require rehabilitation and other types of treatment. And you need really a huge amount of resources to have both the people who can provide that type of therapy and care for those patients, and also the facilities that have the infrastructure that can provide those people the care as well. So we don't have that in Palestine, unfortunately. The second question about UNRWA, I mean, of course, the Biden administration coming in and providing money back to UNRWA after the Trump administration had cut those funds for political purposes, stating that there were no more Palestinian refugees other than those who survived the uprooting from their homeland in 1948, which is a ridiculous statement and not in line with international law. It definitely will help. I mean, UNRWA is a crucial source of support for millions of Palestinian refugees all over the Middle East, particularly those in Lebanon, Jordan, and those from Syria and in Syria, where they don't have as weak as the Palestinian Authority is, they do have their own hospitals set up in the West Bank and Gaza, which refugees have access to. In Lebanon, for example, or in Syria, Syria may have access to the government services there, but with the civil war and all of the huge problems that they've been experiencing there, the hundreds of thousands of Palestinian refugees in Syria, and those in Lebanon simply have to depend on UNRWA and in the private health sector in those countries to get the services that they need. And so that the resources of UNRWA for Palestinians, particularly in the diaspora, not only, but particularly in the diaspora, is crucial for their survival. And to see that their funding was cut just to make a political statement was completely immoral and unethical, but those words have been used before with the Trump administration, and I'm sure they will be again when we look back historically to judge them. But the impact that it had on the lives of Palestinians and continues to have is incomprehensible. The camps in Lebanon in particular, Shatila camp and Burjna Barajna and Badawi, these famous Palestinian refugee camps with hundreds of thousands of Palestinians living in them, are suffering greatly as a result of the crisis in Lebanon, the economic crisis, the political crisis, which is the economy is shut down. And those who are suffering the most are those who depend on the black economy, the Palestinians who are not able to work in Lebanon because of the government restrictions. They depend on an open kind of economy to enable themselves to make enough to feed their family, and that economy has been shut down. So you can imagine the need for UNRWA is greater than ever. So let's hope those funds that the Biden administration has pledged to resume providing will quickly be injected into the Palestinian health system through UNRWA to enable these people to survive during these very difficult days.
Thank you, Steve.
Chris had a question, and maybe an earlier one as well. I'm not sure if both of those have been answered, Chris, or if there's anything you'd like to clarify with Steve there.
Chris has to unmute.
Yeah, we don't hear you, Chris. Sorry.
Over.
There we go. Can you unmute, Chris? We don't hear you yet.
Sorry. Yeah, it was about whether the charity has a UK registered charity status so that we can give you the tax relief on the donations that we would make to you. Same with Green Olive, of course, and any route which you can get that. Thank you.
So I have a call tomorrow with our friends in the UK to set up a charitable status there that will enable us to get tax deductible donations. We know how important that is for donors. So that is something we're working on, and it's the top of our priority list to be able to reach into the community of good people in the UK who care about this issue and want to have an impact and a change and support organizations like ours. We definitely know that's important and we're working on it.
And from Green Olive's side, no, we're not. We're not a charity. We're not registered as such, and we don't work as such. We are a company, for-profit company. We try to kind of meld the activism work that we do with the tours work that we do. So we unfortunately, in that sense, we're not a charity, but in other ways, it does have its advantages, I think, especially in the Israeli environment, where there's a lot of kind of restrictions in many ways on organizations, where there's a lot of support for companies, and we do promote, tourism to as well as a profitable, we hope, profitable business model. Baruch also touched there at the end of your question on the political side of things. Do you have a specific question in mind for Mohammed, I guess, or?
No, I would just love to hear about what is at stake in this election, what is going on, because I am really completely ignorant about it. I try to learn what I can from this and that media, but I would really like that to be clarified if Mohammed would be willing to do that. It would give me a chance to look at his face and his wall again.
Well, I will just give you briefly about the elections in Palestine, in the West Bank and Gaza. And I will go back with you just since 1948, when those two areas had been divided. Israel took over 78% of the historical Palestine, which left about 22% of the land. Part of it was in the West Bank of the Jordan River, which we were part of Jordan. So we were part of the Jordanian regime. And the ones who were in Gaza, they were part of Egyptian regime. So they were different. So during the Jordanian time, we have a couple of elections in 1956. And that was one of the elections that the progressive parties that time, they won the elections, and that caused that also gave the King Hussein of that time to give the right to one of those politicians to form the government, which was mostly progressive, socialist, and so on. And later, within a year, King Hussein just completely gave an order to break down this government, and even arresting most of those communist nationalists in the Jordanian prisons, we call it Jafar, in the desert. We had another elections in the 60s. 66, I believe, was the last elections in Jordan, in the West Bank. After that, we have the Israeli occupation, 67. We don't have any kinds of elections at time. Palestinians mayors at time have been elected before during the Jordanian time, and some of them have been appointed by the Israeli forces, because all the area was under the Israeli military control. In 1977, 76 or 77, it was the Likud party won over the elections that time in Israel. And Ezra Weizman was the Minister of Defense, and he was trying to see, to see what's the mentality of the Palestinians that time after 9 years of occupation. Are they part of Israel and they want to go with Israeli, Israeli plans and so on? So he have launched the local councils and municipality elections in the West Bank and Gaza, which that time the PLO members and the PLO parties have won these elections, and it was a way to leave a message to the Israeli occupation that the PLO is the main responsible of the Palestinians in the West Bank and Gaza. Never made it again. Most of those mayors, some of them have been killed, some of them had been arrested and appointed again by the Israeli military force. It just took us after these things to the first Intifada in 1987, late 1987, and that was the mood of the Palestinians. We are completely fed of the occupation. We are looking to have our own determination of our state, and the PLO should be our leader, and we should have a free Palestinian state, which led us to the Oslo Accords agreement by the PLO and the Israeli government, Mr. Rabin, and which gives the right to the Palestinians Authority that time to establish in Palestine under the umbrella of the PLO, which Mr. Arafat came and took Gaza, slowly to the West Bank cities. And according to that agreement, it should run for 5 years because the areas have been divided for area A, B, and C. And you have seen that while you were visiting. And according to the agreement, because area A was almost 18% of the whole occupied territories, area B was almost 22%. What will be left, which is about 60%, was under the full Israeli military control. But according to the agreement, part of area C should move to area B and part of area B to move to A within the 5 years up till 1999. Mostly over 75% of the land should be under area A, which is under the full Palestinian control. And what will be left will be for further negotiations between the Palestinians, PLO, and the Israeli government about the 2 big settlements blocks in the West Bank. North one is Ariel, and south one, which is Gush Etzion, the Jordan Valley area, and Jerusalem. And also the issue of the Palestinians refugees. These were the main things that they had been postponed for the last or final negotiations between them. But things which went much more difficult after the assassination of Mr. Rabin, the Likud party came up to be the main power that time. Mr. Netanyahu was the prime minister because it was a direct elections for the prime minister in Israel. So he took the advantage to be the prime minister of Israel, and he himself didn't believe in the peace Oslo Accords negotiations, and they started to order to put in new settlements in the West, which caused also a lot of trouble in 1996. And also 1998, 1999, Israel had the new elections at that time. And the Palestinians in 1996 had the first general election since 1966 in the West Bank and Gaza. And that was only for the Palestinian Authority, which was the major part of it, Fatah movement, and other small fraction of the Palestinians Liberation Organization, but not Hamas. During the first Intifada, the major power was the PLO. So all these demonstrators, all these youth in the streets, all were just chatting, and the slogans was for the PLO. Now Israel had created a new body through the first Intifada, which is Hamas, which wasn't part of the Palestinians Liberation Organization fraction. And that Hamas, as a way to be part of it, they started to do, armed struggle, where the Palestinians of the PLO stopped the armed struggle, according to the Palestinians' agreements with the Israelis. And that caused also a trouble. And Hamas wasn't part of the elections in 1996. Okay? So the first general elections, which happened since the occupation, it happened in 1996, under the umbrella of the Palestinians, the new authority, or the PLO. Now, we reached 1998, where Israel had new elections, which Mr. Barak have took over, which is the Labour Party, which was one of the largest and the powerful parties in Israel. And they didn't reach with the Palestinians Authority the deal, which had been signed. in the beginning of Oslo, and that's in Washington D.C. During Clinton administrative. They failed in reaching an agreement, which caused the second Intifada in the year 2000. Okay, and that was part of the Israeli policy, is to find a solution for its power to siege the Palestinians' towns and cities completely. It was completely, a disaster for the Palestinians, because you could not leave Ramallah to go to villages around, or from these Ramallah to Nablus or other cities. Each city by itself, each governorate had been completely isolated from the other. And we lived in this situation for a couple of years. Even in that time, Palestinians could not drive on special roads that the settlers and the yellow license plates have to drive on it. It was against the law that time. It was a military law. So we reached 2004, where Mr. Arafat had passed away, and they said they have to break the situation, and we called for new elections for the presidential election in Palestine, which happened in the year 2005, and the general elections for the parliament in 2006, where Hamas was part of it. But according to what came out of the elections, that Hamas won the elections. And now Israel took the advantage of that, declaring that Hamas is a terrorist group and we are not ready to work with it. So all what the Palestinians have done is completely useless. And that caused also, later on, the division between Gaza and the West Bank, where Gaza was under Hamas completely control in the year 2007, and the West Bank was under the Palestinian authority control. And since that time, we didn't have any kind of elections. But Israel, in fact, usually they do kinds of survey to see what is the mentality of the Palestinians, what they are in their minds, what they are thinking about. So they are letting us do the elections, in fact, to see who is going to win. Because the first 2006 elections have put the division between Gaza and the West Bank. So they are thinking that if we will have another elections nowadays, we might have more cracks in the build of the power of the Palestinians PLO, and also it might happen even in Hamas, or other fractions will get out, and so this is one of what Israel is planning for the elections in the West Bank. We are not really ready for it. In fact, there is a big discussion about it. Even it is already declared that Mr. Abbas, our president, have called for the elections. We have the first elections for the Palestinians the parliament in May 22. We have the presidential elections in August, 31st of August, and also the PNA, which is the Palestinian National Council, in end of August. So we have July, August, and May, the elections. But in fact, there's a big problem that the Palestinians are facing. First of all, Israel will never give up that the Palestinians of Jerusalem should be interfered or involved in the elections, because Israel believes that East Jerusalem is part of Israel. Even if we will be given the right that the Palestinians of Jerusalem could have the right to vote in the general elections in the Palestinians, they will never vote inside Jerusalem border. They have to get out to suburbs of Jerusalem, which is not part of Jerusalem boundaries, to be sure that no power of the PLO or the Palestinians Authority in Jerusalem. This is what Israel wants. And as a challenge, the Palestinians have decided that the people of Jerusalem, the Palestinians, residents of Jerusalem, have to be involved in any general elections in Palestine. So this is a big challenge that we are facing. We don't know what will happen, but Israel will never give up the right for the Palestinians of Jerusalem to vote inside Jerusalem border. No chance. Now, to go farther, Fatah movement itself, it is divided now, because since the Oslo Accords agreement up till today, the failure of the Palestinian Authority is very, very hard for the Palestinians to accept it. Because we were promised that we will have a free country, We promised that we have our own borders, airport, port, all that didn't happen. And even the situation which we were living in it was much better than the current situation. So the Palestinians now looking for a new body should challenge both sides, both Fatah and Hamas. And they are depending on the leftist groups in Palestine, the liberal parties, and also some of those individuals, very trustable politicians in Palestine. So we don't know if it will be work or it will be completely again if the Palestinians of Jerusalem are not given the right to involve and to share the elections. This will be completely as a way to drop down calling for the elections. It might happen that again they will drop it down because this will, as a Palestinian Authority, will say that the whole cause of failure of the new elections because of Israel is not giving the right for the Palestinians to go on to practice their rights as a human being, as any country of the world. This is what will happen.
Thank you very much, Mohammed. Just one question. Did you say that Israel created Hamas?
It's a way to support Hamas that time, because Israel depends on the division of the Palestinians people. Because when we are in unity, it will be much more power for us. So Israel is trying to build another body, even not only Hamas. It's another body that will be completely a third body in the West, in the occupied territories, and even for the Palestinians in the out of the country, that they have their own organization that they could deal with it. They don't depend on what we call it the PLO or the Hamas group. That's what Israel is trying to do.
Yeah, but way back when, I sort of missed a step. How did Hamas become
in the first Intifada? In the first Intifada, because in the first Intifada there were leaflets led by the Palestinians United Leadership, and Hamas started its own leaflets for the Palestinians to organize the daily life of the Palestinians. So the PLO leaflets, which had been, spread all over the countries, had been collected by the Israeli intelligence at that time, and it was very hard but they were given the right to that time in the first Intifada to Hamas groups to spread their, leaflets and their programs as a way to support and to empower Hamas against the PLO. That was the reason in the beginning. But now both sides, and even up till today, Israel doesn't want to have the reconciliation between Hamas and Fatah. They don't want to have it because this will it will be an obstacle to the Israeli plans. It is a way to say that we cannot go on with the peace negotiations because we still believe that Hamas is a terrorist group and they don't believe in the rights of the Israeli state, where Hamas just recently have already declared that they are accepting the two-state solution, which the PLO have signed for it. But that will not be accepted by the Israelis. So Israel is, is still playing in this kinds of situation that they keep both sides away, and even to build a new body in the Palestinian areas as a way to challenge Fatah, the PLO, and Hamas. This is what Israel is, to give us in a chaos that nobody could understand what is going to happen.
It's a divide and conquer, isn't it? I guess that's the oldest trick in the occupation book. Yeah. It's divide and conquer.
That's right.
Yep.
Well, thank you very much for that very comprehensive answer. I think you really
let me just draw your attention just for one thing that it is happening nowadays. We are facing a lot of aggressive attacks of the settlers now in all over the West Bank and even in Jerusalem. Imagine every Saturday, the Israeli ultra-Orthodox have a demonstration which usually will stone each Palestinian car passing. Just 2 days ago, a Palestinian car had been ambushed by those Israelis, which caused a death of an Israeli settler because the guy could not, he was running away with his car, with his vehicle, away of the stoning. He crashed over Israelis, which caused a death. So that this driver now he's arrested. He's in a hospital because he had been beaten badly by the settlers in East Jerusalem. I'm talking about road number 1, which is dividing the city. So Israeli now, mostly in each Saturdays, Fridays night, Saturdays, they are attacking the Palestinians in Jerusalem area, and also in the West Bank. There's a lot of daily harassment and daily attacks, aggressions from the Israeli settlers against the Palestinian farmers, against people, driving on the roads, which they are blocking streets, throwing stones on the Palestinians, even using guns, even somehow, sometimes shooting against Palestinians. So it is a very, very critical situation for the Palestinians nowadays, even under this closure of what we call it the Corona pandemic, and also that the people all over the world, they are not focusing over what's happening under the Israeli occupation in the Middle East.
Yeah, right. There's a lot of distractions. So, my friends, we have about 10 more minutes before we really have to say goodbye. So, if anybody does have any further questions, please feel free. Now is the time. Maybe I could just ask you a political question, Steve. I know this is maybe not your speciality, but you obviously have a lot of experience. So, can you look in the crystal ball? Do you predict that this election will really go ahead, or is that a step too far for you?
I don't see it going forward, to be honest with you. This is one of those issues that they bring up every once in a while to try to show that there's something being done, when in fact there hasn't been anything done politically to show any signs of progress or any effort to move forward in what is clearly Israeli intransigence, American intransigence. I mean, at the end of the day, the UN and Israel are in the Middle East. They certainly have the power and the leverage to get it done, including an election. So we can call it American-Israeli intransigence when it comes to Palestine. There's no interest in seeing, as Mohammed clearly and articulately outlined, there's no interest in seeing any type of movement politically to give the Palestinians a voice and a say in their own future and their own political representation and their own authority, however limited that authority may be. So I don't think so. I think this is just talk. I also don't think that the powers on the ground in Palestine, either in Gaza or in the West Bank, necessarily want to see a change in the status quo, because that change could alter the current, their current limited power that they have. We saw that in 2006. So I don't see any parties other than the Palestinian people themselves who want to see elections. But of course, nobody has ever asked the Palestinian people themselves what they want or adhered to any of their interests since the 1917. Unfortunately, because we are in the 2021, this is a time when elections are relatively simple. Here in this country, we had the highest turnout in the United States, where I am currently. I generally live in the West Bank, but at this time I'm in the US right now. In 2021, we had the highest turnout, 2020, November, the highest turnout ever in an American election during a pandemic. It proves that we can hold elections, safe elections these days, and that the will of the people should reign. But unfortunately, when it comes to Palestine, the will of the Palestinians is never taken into consideration.
In addition for what Steve has said, since 1994, since the Palestinian Authority have been established, Israel had over 8 general elections in Israel. We had only 2. Israel, even we could see it since the year 2002 up to today, that Israel is completely shifting to more extreme right wing. We could see that the peace which we are talking about since 1994, which had been signed by the Palestinian Liberation Organization and the Israeli government at that time, which had been led by Mr. Rabin, completely vanished, completely. The Labour Party, which was the main power in Israel now, it doesn't have more than 5 members in the Israeli Knesset. And mostly every elections that is happening nowadays in Israel, it's shifting more to the right, extreme right wing. Even just imagine when we are talking about Mr. Netanyahu, he's showing himself that he's a liberal. Even some of the extreme right wing saying that Mr. Netanyahu is part of the leftists, even. So this is what is happening. So Israel society is completely away from what we were thinking about. We have, small percentage of the Israelis which still stick to the peace camp and still stick to the peace with the Palestinians, but the majority in Israel, over 80% of the Israeli community, completely away from what we are thinking about, this peace in this area. They think that the land here belongs to them, and those are strangers, and it's mainly if it comes up for them, they have to transfer us away from the land here. This is what is happening. This is what is going on. But Israel usually wants to have a survey for the Palestinians' mentality, what they are thinking about. And that's why they are curious to see who's the main power in the Palestinian society. Is it Hamas or the PLO, or there's a new body or a new, you have to imagine that since the occupation in 1967, we have more than 3 generations of Palestinians had been born since the Israeli occupation. So since the first and the second elections, which happened in Palestine, we have a 3rd generation, which those young fellows, they don't know what is their future is going to be. And they don't know what will happen to them. And this is a serious, problem that the Palestinians are facing. And there is no answer for it, really, because the internationalism is not in a way to find the solutions in this conflict here. When it comes to Palestine, the Israelis and Palestinians, the Americans will say, we are out of it. We are supporting Israel. They are saying it openly. Even they are just bringing other Arab countries to put more support and to put more pressure against the Palestinians and to let us go with their plans, which I don't think that the Palestinians are accepting it. And that comes to feel that we are completely in a dark tunnel, that there is no light to show that we could get out of this situation.
Are you referring to these normalization deals, Mohammed, with
Well, of course,
UAE, America?
we have a lot of those Arab countries, which Israel have, and the Americans have, forced them, even though, to come to do the normalization with Israel and to have embassies in Israel. And that left us as Palestinians alone to face this kinds of situation.
Nancy, did you have a question? I saw you just typed in the chat there. If you do have a question, please feel free to unmute yourself and ask it.
Okay. Mohammed, thank you for your presentation. And I am wondering if you can help us understand the internal political divisions within Palestine with respect to the upcoming elections.
Well, I have mentioned that there's several political parties are joined under the umbrella of the PLO, which they agreed to go for the elections, all of them. Even the Popular Front, which they didn't accept the elections in the year 1996, but they were part in the year 2006, and now they already have signed for the elections and they want to be part of it. Hamas wants to be also part of it. I said there is several parties in the PLO, like the Democratic Front, the Nadal Front, the Popular Front, the People Party. All those are accepting the elections. And those are, we have in the PLO, we have Fatah, which is the largest movement in the PLO, and they are the head of the authority in the occupied territories. But we have leftist parties, socialist parties, liberal parties, which they want to come to build a bloc, a list, and they are negotiating among themselves. If they will succeed in having it, I think there will be, kind of an advance for the Palestinians to believe that there is a chance to have another powerful party which could challenge Hamas and Fatah movement. And I believe that in Fatah movement, there is a lot of those members. They want to get, maybe they will have a special list, you know, in spite of what Fatah movement will have the main leadership of Fatah, but there are some others like Marwan Barghouti, which is a, you know, he's a very famous leader of Fatah movement. He wants to have his own list, which will be much more progressive list than the Fatah movement leadership, which is the authority list. If this list, if it will come up, and they will join also the new build-up leftist party list, it will change a lot in Palestine. And I hope it will happen if the elections will come on, and those new lists will come up and build a new bloc. I believe that things will change. I believe even though that will reflect in positive way for the PLO, for the Palestinians in the diaspora, and also for all the Palestinians' needs and goals. I hope it will happen.
Thank you.
Thanks, Nancy, and thanks, Mohammed. And I'm afraid, my friends, that we're probably going to have to wrap things up now. We've almost reached our hour-and-a-half mark. So first of all, I'd like to say thank you very much to both Mohammed and Steve for spending time with us tonight. Then I'd like to thank everyone of you who's joined us tonight. And we're going to put this up on our YouTube channel, so if people are watching this at a later date, I'll say quickly hello to you. And maybe, Steve, if you have any final words, I can let you say goodbye now.
Well, thank you, Alex, and thank you everybody from Green Olive Tours and for everybody who joined this call today, particularly Mohammed in Gaza, who's a very interesting voice on the Palestinian perspective. I think it's important for us to, as all of us who love Palestine and believe strongly in the Palestinian cause, feeling frustrated and often cynical about the opportunities to bring real change to the Palestinian issue and the Palestinian struggle. There are ways to have a positive change. Green Olive Tours is one of them, of course. So is PCRF. So I want you all to just not lose sight of the impact we can have as individuals, especially when we work collectively as a group, as we're doing here this afternoon, to stay focused, stay strong, stay active, and not lose ever our resolve to support the Palestinians in their noble struggle for freedom and for justice. That's it.
Thank
you. Would it be possible to have Steve's email?
My email is so easy. I'm going to write it in the chat box, but I'm also going to tell it to you now, which is it's steve@pcrf.net. But I'm going to write it right here in the chat box. So if you have an easier email than that, I'd like to see what it is. So feel free to contact me anytime. We would love to expand into the UK. We have brought a lot of British doctors over to Palestine to volunteer. And it is a place we would like to also send children for medical care. That's something we still do, send children outside for medical care when COVID's over or able to travel. So we do look forward to working with all of you. If you're interested in hearing however you would like to be a part of PCRF, we're always looking forward to working with volunteers.
I will thank you all also for joining us today. I hope that we will go with this kind of tours or discussions, because I think that the coming months is completely it is important to go with it to understand what is happening. So we will do these discussions and more every 2 weeks. Maybe we could arrange it, or every week if it's needed, as a way to show you what is happening in the Israeli election side and also in the Palestinian side.
Thank you very much, Mohammed. Thank you very much, Steve.
Thank you.
And we hope to see you all again. If not physically, come visit Palestine and take tours with us. Or of course, we're still doing during COVID these online tours, as I mentioned. So you can check them all out at greenolivetours.com, and Steve, pcrf.net. Is that your site, correct?
It is pcrf.net. Yep, all of our information and work is on there. Thank you, everybody. Thank you, Alex.
Thank you. Thank you,
Thanks,
Brock.
Mohammed.
It's nice to see you. Thank you, Steve. Thanks.
Shukran.
Thank you so much.
And hello to your children and your grandchildren.
Yeah, well, of course we are missing you. So usually every year you should be with us. In October, you should do it again.
I hope so.
All right. Have a good night. Bye.
Bye-bye.